So the book that I chose was America's Forgotten Pandemic, The Influenza of 1918 by Alfred W. Crosby. Alfred Crosby was a professor of history, geography, and American studies at the University of Texas at Austin and the University of Helsinki. A lot of his research combined geography, biology, history, geography, biology, and medicine, and focused heavily on epidemics. The main argument of the book was that despite all of the advances made in epidemiology and public health in the 19th century, the 1918 Spanish flu epidemic was the greatest failure of medical science in the 20th century and possibly of all time. It spread pretty quickly across the country, and not a lot of people were prepared for it. This happened for a bunch of reasons. World War I was happening. There's a lot of troop movement across the Atlantic, and at training camps in the U.S. and on the battlefield and at the draft board or whatever. And the war also kind of captivated people's attention more, held people's attention more than influenza did. And it didn't receive as much coverage, and people didn't really care as much about it as they did the war. Or they didn't care as much about influenza as they cared about the war. What else? Even though there were a ton of public health departments established around the country, the United States Public Health Service, as well as all of the individual state health departments, they were kind of caught off guard. They didn't really prepare for a new widespread pandemic, of a pandemic of a new disease. But even if they were prepared, most of the health departments were underfunded and understaffed, and they also kind of lacked the central planning to effectively fight the disease. And a lot of the policies that they did implement to kind of control the spread of influenza were taken after, the policies were made after the disease had already arrived to their cities. So they couldn't really do too much. It wasn't super effective because it was already spreading. So the organization of the book worked pretty well. Crosby started by explaining the origins of the Spanish influenza in the United States in early 1918. We discussed the spread in Europe and other parts of the world, and it kind of circled back and focused on the spread across the United States in late 1918. After that, he kind of zeroed in on the spread amongst various locations and organizations, such as Philadelphia, San Francisco, various warships, among the AEF and at the Paris Peace Conference. After that, he kind of dove into some of the statistics and discussed some of the theories about where the flu came from and why it was so bad. Because normally the flu would show up, kill a couple people, and then disappear. It wasn't as widespread. And then he explained how the flu went from kind of like a pandemic to an endemic sort of thing, and looked into how people remember the pandemic. He also talked a lot about how the First World War helped the spread by encouraging the movement of infected people and distracting people from the spreading virus throughout the book. That wasn't really confined to one chapter. It's kind of in all of them, sprinkled throughout. He also spent a lot of time talking about government efforts to stop the spread of the virus throughout the book as well. That wasn't really confined to one chapter. It was kind of in all of them. I thought I thought the organization was pretty straightforward and mostly pretty easy to understand. I got confused a little bit, but that might have been a me thing, not a book thing. And overall, I think the organization worked pretty well. Most of the sources he used were newspaper articles, official reports, and medical journals. These were probably more reliable than other firsthand accounts like diary entries or whatever, just because they covered a wider area, and the newspaper articles did, and the medical journals more from a scientific perspective than diary entries would be. The methodology, it seems that he mostly used first-hand sources from newspapers and official reports, like I just said. For most of the statistical measurements, the impact of the pandemic, he focused the statistical measurements of the impact of the pandemic, sorry. He focused on the numbers of flu and pneumonia deaths week by week of sailors, soldiers, and civilians, which I thought worked pretty well. Relevance to historiography. In chapter 5, he explains some of the questions that he had when he was researching how to write about and study the pandemic. These questions included what happened to individual people, families, and communities, how did people react to Spanish influenza, and which areas and groups of people, individuals, small communities, large cities should we study. These or similar questions could be used by other historians who are trying to write about other disasters. He also focused on death count and not case count and looked at how the events occurring at the same time influence the spread of the influenza, which could impact the way that other historians write about pandemics. Strengths. He cast a pretty wide net and covered a lot of information. He talked about the Welch stuff with the investigation at Fort Devens and kind of the spread throughout the country and boats and the AEF and in Europe. So a lot of information discussed. He also provided a lot of context and a lot of details about what was going on more generally outside of the scope of the pandemic, I guess. Also a lot of details just in general about the pandemic as well. He also brought up a lot of interesting questions and historiographical issues. Weaknesses, it's a little repetitive, but that isn't really the author's fault. It's just because the same thing was happening in so many of the cities. But also the author's wording also got a little confusing at times, I thought. But again, that might have been a me issue and not a book issue. And also parts of the book were a little dry. Like I think in chapter 11, he spent a lot of time talking about the statistics and all the death counts and stuff. And a couple other parts of the book besides that were pretty dry, but that was the main one. But just some patches of dryness here and there, I guess. But yeah, that's really it. Okay.